Hello and welcome. My name is Naomi. I am a dietitian based at Crawley Hospital. In this short video, I'm going to talk to you about what is a cow's milk protein allergy and what are the symptoms to look out for. So what is a food allergy? Now there are a number of different types of reactions that we can have to foods, but a food allergy, and in this case a milk allergy, is caused by the immune system. So it's when the immune system reacts to cow's milk proteins as it sees them as something harmful and it goes into its defence mode. So there are two types of allergic responses that we can see, and the first one is called an IgE mediated reaction. Now IgE stands for immunoglobulin E, and that's the name of the antibody, which is a protein produced by the immune system. And with this type of allergy, we usually see symptoms instantly and within 2 hours of having consumed the milk. But with the second type of allergic response, this is called the non-IgE allergy. And the reactions we see with this type of allergy are delayed, and we can sometimes see them after 2 hours up to 3 days after having the milk. And this delayed reaction is also caused by the immune system, but the IgE antibodies aren't involved in the same way as they are with the IgE mediated reactions. So a little bit more about IgE reactions. Now these are instant, so they progress very quickly. So symptoms will occur as soon as your child eats, drinks or touches some milk. And because these reactions are instant, they're usually easier to spot. So we have two types of tests that can help confirm whether an IgE allergy is present. And these can be in the form of blood tests or more usually as skin prick tests. So what are the symptoms that we might see with IgE mediated reactions? We often see them in the skin, so we might see hives or urticaria, which is a nettle-like rash, appear on the skin. We might see swelling, redness and itchiness of the skin too. So you can also see respiratory symptoms, so sometimes that can just be a runny nose. You might have an itchy throat where you might see a cough or reflux in a child. And you can also see wheezing and difficulty with breathing. So with the gut, you can have vomiting, abdominal pain and diarrhea. And other symptoms you might see, fortunately these are more rare, but they are possible with IgE reactions, are sleepiness in a baby, shock and collapse and anaphylaxis. So non-IgE mediated reactions. Well, non-IgE allergies can cause symptoms that appear after hours or days after drinking or eating the milk. So the child can react to milk proteins from breast milk or from standard cow's milk formula. A non-IgE allergy can be more difficult to spot because reactions take longer to appear. We don't yet have a diagnostic test for non-IgE reactions. The only way we can diagnose it is by removing all milk proteins from the diet and seeing if the symptoms disappear. And then if we reintroduce the milk proteins, they appear again. And at that point, the diagnosis is made. It's really important to do this, as many of the symptoms we see with the non-IgE reactions are also seen in otherwise healthy babies or with other conditions that are common in childhood, and we don't want to exclude milk unnecessarily. There is guidance on how to exclude milk and reintroduce it, and they will be given at the end of this video. So what are the symptoms of non-IgE reactions? Well, we can see them in the skin, so that's atopic dermatitis, so eczema, or we can just see generalised rashes. In the gut, this is where we more commonly see symptoms. So you might see vomiting, constipation, diarrhea, blood or mucus in the stool, and a baby that's quite fussy with their feeds. And other symptoms we can see, sometimes in severe cases we see poor growth, but generally you just have a very grumpy baby. So what are the risk factors of developing a milk allergy? Well, we know that if there is a family history of atopy, which means if mum, dad or a sibling has a hay fever, asthma, atopic dermatitis, eczema, or if they have a food allergy themselves, your child might be more likely to develop a milk allergy. If your baby has a history of eczema or atopic dermatitis, hay fever or asthma, again, this may make them more susceptible to developing a milk allergy. We know that cow's milk allergy is more often seen in formula-fed babies than in breastfed babies. However, cow's milk allergy can also be seen in breastfed babies. We would always encourage a breastfeeding mum to continue breastfeeding wherever possible. So thank you for listening. I hope this video has been useful. There are some handouts that accompany these videos, and I'll post links to those at the end. And further information of the management of cow's milk protein allergy will be provided in future videos. And any further questions in the meantime, please email or telephone our dietetic team. Thank you.